Welcome to the JEMS Report, brought to you by Clarion Events, Fire and Rescue Group, and the Journal of Emergency Medical Services. My name is Ted Lee, and I'm the Editor-in-Chief of JEMS, along with Jeff Frankel, our Managing Editor. The JEMS Report brings position matter experts and field providers to talk about various topics in pre-hospital medicine. Today, we have a very special group with us who's worked on a new project with stroke awareness. So, guys, why don't you start with introductions, and then we'll get into the meat of your project.
Great. So I'll get started and then we'll introduce ourselves. So my name is Aditya Jain. I was one of the co-founders and I'm the current CEO of MedicZero, which is the organization that all of us work with. MedicZero is a 501c3 nonprofit that essentially aims to innovate the way that CPR and first aid education is delivered to bystanders. And a big part of that is by providing stroke recognition training in concord with all of our CPR trainings, which is a little bit about what we'll talk about with the project. So my own background, I recently graduated from Rutgers University with a degree in cell bio and neuroscience, and I'll be starting medical school at NYU Grossman in a couple of months. So I'll turn it over to Yash.
Hi, I'm Yash, and I currently serve as the Chief Administrative Officer at MedicZero, and along with Aditya, I was part of the founding team. Just like him, I recently graduated from Rutgers last spring, and currently I'm applying to medical school. I've been an EMT for about the past 6 years. So along with MedicZero, I really feel like emergency medicine and its deployment to the masses and bystanders is really, really crucial. And so that's part of my work there and making sure that we're able to deliver it to as many communities as we possibly can, teaching them things like hands-only CPR, how to recognize strokes, how to control bleeds, what to do when someone's choking, et cetera, et cetera.
Hi guys, I'm Beth. I am also with MedicZero. I'm the Chief Clinical Officer. I graduated from the University of Virginia with a bachelor's in neuroscience, and I'm currently a student at New Jersey Medical School, and I'm also a paramedic and an educator for Capitol Health.
Oh, great. Thank you guys for joining me today. Why don't we start off with a little bit more about MedicZero and what the mission of that is before we get into the specifics of the stroke awareness.
Yeah, absolutely. Would love to talk about that. So again, MedicZero is a 501c3 nonprofit. We operate mainly in New Jersey and the tri-state area through a university-based chapter model. And our mission is to innovate the way that CPR and first aid education is delivered to bystanders, specifically to increase the accessibility with relation to cost, time, and complexity of the material. So just to kind of frame with a couple of statistics, in cardiac arrest, every 1 minute that a bystander doesn't receive CPR, their chance of survival decreases by 10%. In stroke, every minute that somebody does not receive care, they lose 1.9 million neurons. So time is very, very important in these medical emergencies, and bystander care being delivered quickly is also very important. And despite that, less than 50% of people who go into CPR in public receive bystander CPR, and it takes an average of 5 hours for bystanders to call for 911 for a stroke. So essentially, although this training exists, it is just not accessible to the vast majority of bystanders in the United States. And MedicZero, through like pop-up and walk-by trainings at parks, booths, fairs, schools, etc., aims to improve the accessibility of this education so more bystanders can feel confident in providing these skills when they're needed most.
And how long has MedicZero been in existence?
Yeah, so we were founded in 2020 during the pandemic. Funny enough, we did our first bunch of classes in 2020, 2021, all virtually over Zoom. So we would ship inflatable mannequins given to us by the AHA over to students, and then they do it with us on Zoom. Now, of course, we've transitioned to all in person, but just about 4 years, and we're continuing to grow every single day, and very much excited for what the future has to hold.
So, with since that time frame, about how many students have you interacted with?
Yeah, MedicZero has trained just over, I think, 6,500 as of last week. And a lot of that, almost 3,000 of that has been in just the past year. So we've, been growing a lot since initially. We started with a team of 5. Myself and Yash were 2 of those 5. And now our team, I don't even think I have an exact number, but it's over 70 to 80 officers, interns, volunteers, and just so many people that are helping out with the cause, all on a volunteer and free of cost basis.
Wow, that's great. So you're reaching to the community. You said mostly New Jersey, New York area?
Primarily New Jersey, so we operate out of university chapters, and the main flagship chapter that Yash and I helped start was at Rutgers. But now we have other chapters at, for example, Villanova or Temple University in Pennsylvania. We're hoping to start things at NYU and Adelphi. In New York, we have things at NJIT, so we're kind of home base is still New Jersey and home base is still Rutgers, but we're looking to expand beyond New Jersey into the tri-state area and hopefully beyond.
Oh, great. So yeah, you mentioned schools, but I guess I didn't fully understand that just how they were based out of that. So a lot of your volunteers are coming from people that are coming up through, going to med school or nursing school, something in the health sciences, EMS, hopefully, of course, since this is a direct help for that line of work as well. So that's great. So let's talk about your newest one. And you guys wrote an article for JEMS on your stroke awareness testing. Does somebody want to talk about the article? You're on mute.
Sure, sorry about that. Yeah, so again, one of the biggest things that we want to do here at MedicZero is just innovate the way that these skills are delivered. And a big part of that, and something that we've done all the way from the beginning, is include stroke education as part of all of our CPR trainings. So the inspiration for this comes back to kind of all of our introductions where we mentioned that, myself and Yash were both EMTs, and Beth was a paramedic for quite some time. So all of our inspiration for papers like this and for the organization as a whole comes from our experience as clinicians working with patients on the trucks. And a big thing that I think all of us saw and something that we could all relate to when we started MedicZero was that not only in CPR but also in stroke we saw a huge delay in bystander recognition. So I think all of us here on the call can recount experiences where we had stroke patients, and for all EMTs and all paramedics, an important question that we ask is, when were you last normal? So that we can give that information to the physician, the neurologist at the hospital. And often we would get answers that were really surprising, of multiple hours or sometimes even the day before. And this is something that came up repeatedly as a theme, and that's why we integrated it into our training. So recently MedicZero, and this is actually MedicZero's first research paper. So recently we've started a research arm aiming to kind of disseminate some of the information that we know and we base our trainings off of to kind of the wider audiences. And this was one of the biggest things that we thought is pretty undervalued. It only takes us 5 to 10 minutes to integrate bystander stroke education during our CPR trainings. And this is something that ideally should be done throughout the country in CPR trainings. And our paper focuses on the importance of timely bystander stroke recognition, and even some initiatives that have happened throughout the country and throughout the world, apart from our own, that have been successful in not only teaching bystanders about stroke education, but they've even measured the downstream effects on how quickly people thereafter get care. And they've been successful at increasing education and at lowering the time that it takes for people to get care after a stroke. So really inspiring initiatives, and hopefully, I think the goal of this paper is to just have people see this and hopefully integrate more of these initiatives, as time goes forward.
Right. So with that in mind, and you mentioned some of these initiatives, can you dig down a little bit deeper on, what the findings were, and, how impactful is this, 5 to 10 minute worth of training, what is the real ramifications for that to the end user?
Absolutely. Yeah. Beth, do you want to take this one?
Yeah, sure. So I can start us off. So we found that even though these trainings are short, some of the papers that we looked at were looking at trainings as short as a TV ad. They're short, but they have significant impacts on the community. These researchers were able to measure that even after that short training, the time that it took for people to call 911 after a stroke decreased. So like we've been saying, these trainings are low cost, low amount of time invested, and they can have actual impacts on patient care later.
Yeah, one of the biggest hallmarks that we found throughout the different interventions in actually increasing bystander awareness of stroke is the fact that simple communication is important, as well as communication that really highlights the actual urgency of strokes. So a lot of times bystanders are actually able to recognize that something is not going right medically in the patient. However, they're not able to identify the urgency of the matter, and they're not able to, quickly call 911 and make sure that that person gets to the hospital as soon as possible. A lot of times what happens is that they end up calling non-emergent ways, or like they call the primary care provider. And although that does get them care eventually, it actually, like Aditya mentioned, it delays care, which negatively affects, the patient's odds of survival or their odds of having a successful recovery after their stroke. So these interventions, the biggest goal was to make sure that people who were trained recognize that they need to get stroke victims to the hospital as soon as possible. And if they recognize simple symptoms, such as the fast pneumonic or the B fast pneumonic, then they can greatly increase that patient's chances of, having a better prognosis.
So inside of this training, you mentioned the fast pneumonic. Is that the basis of what the bystanders are learning to be more aware of?
Yeah, so it's primarily the fast mnemonic, which has actually been upgraded to the B fast mnemonic, B for balance, E for eyes, and then fast for face, arms, speech, and time. So this is primarily the method that we use to teach, and primarily the method that even the studies that we mentioned in our literature review use to teach bystanders. And I think one of the key elements that we really want to emphasize about this mnemonic, and this is a very key element that we emphasize even in our trainings, is that patients do not need to meet each of these criteria or all of these criteria to be having a stroke. Patients just need to be meeting one of these symptoms or signs to potentially be having a stroke. And I think that that can be a pretty common misconception among bystanders. For example, if the only symptom is slurred speech, or the only sign is slurred speech, the bystander might think it's something else because they don't have that characteristic facial droop that we all associate most with stroke. So although BFAST is the acronym that we use, I think a key element of that is, really emphasizing to bystanders that just one of these signs is cause for concern and to call 911 as soon as possible.
Right, and with a lot of medical signs and symptoms, people like to, or for fear of it, if it's not all of it, then I must be fine. We go back to the classic chest pain. Well, if it's not substernal, in the center of my chest, it's not chest pain, then I'm not having a heart attack. It's something else, and I'll be fine. And then they usually delay care, even though it doesn't, exactly meet what somebody told them they should be looking for. So, this type of education and training, the hope I gather is that they're more aware of, the different nuances of it, and the fact that something is wrong means that activation becomes more important.
Definitely. And that's actually what we really try to stress during our trainings. And that's what we've noticed that a lot of these papers tend to highlight. Time is really crucial and of the essence, because the time at which the patient arrives at the hospital dictates kind of their qualifications in receiving thrombolytic therapies. 80% of strokes are actually acute ischemic strokes. And potentially for these types of strokes, if that patient is in the ER or at the stroke center as quickly as possible, then that patient can be given certain therapies, which even that if they delayed like on 15 minutes basis, could actually make that patient's symptoms worse, or potentially cause even worse consequences. So every minute actually counts in a stroke.
Yeah, and just wanted to quickly highlight another thing is that for that therapy that Yash mentioned, the thrombolytic therapy, the generally accepted practice, and what I learned when I was, starting EMT school, is that thrombolytic therapy is able to be given within the first 4.5 hours. And kind of that's the hard point after which it's not as effective and before which it's super effective. But when we were doing the research for writing this paper, we learned that for thrombolytic therapies, if you give it between 0 to 90 minutes of stroke onset, even that is twice as effective as 3 to 4.5 hours after stroke onset. So although 4.5 was that traditional hard number of, if you can just give it within 4.5 hours, it's super effective. We learned that even within that 4.5 hours, there's a lot of room for change in potential outcome if you can give it even earlier. So, really want to echo Yash's point that every minute really does matter. 4.5 hours is a loose guideline, but, the sooner is really the better. And even 15-minute intervals were found to be significant statistically in patient outcomes, depending on how fast it was given.
So with the state of EMS, across the nation now and delayed in response times, resources being tapped, the ability to recognize and call as soon as possible when you have potential wait times of, 20 minutes or 30 minutes, or even, a miscalculation of this is a subacute or a non-emergent call, could really impact somebody's overall outcome should this be missed.
Yeah, I believe the number is that in the United States, it takes an average bystander 301 minutes to recognize stroke and bring that person to the hospital, which is really alarming, considering the fact that, like as we mentioned repeatedly, that every minute counts during a stroke, and that more and more neurons and brain tissue are lost as more time goes on. So just making sure that more people are aware of stroke, I think really goes a long way in ensuring that people receive timely care. In one specific UK study, they found that actually just by running a 40-second advertisement over like spread out over the course of a year, they found that over 8,000 more patients actually got to the ER during that time period for acute stroke emergencies. And the number of non-urgent calls that EMS received for strokes decreased by 50%. So something simple and just making sure that people have that awareness really goes a long way.
Well, education seems to be the key to almost everything. And, as people become more aware, they make more, accurate decisions on what's going on. So, getting out to the community, and the response is only as good as the activation, and the activation is only as good as the education of the bystanders or the people around you that would be calling 911 or the individual calling 911. So this goes to, a pretty significant part of EMS as a whole, and addressing patient care. So what's on the horizon for this? What are you guys looking for? Are you going to continue to draw in these numbers and see what kind of impacts you're providing?
Absolutely, absolutely. So I'll take this one. So for the research department, this is actually really exciting for us. It was an idea when we just talked to some others, and we got some amazing support from, just want to shout out a couple of other people, Pranya, Julia, Dr. Yuan, and Lesia, who were all part of this study. And we got amazing support to do this research. This was our, again, as I mentioned, MedicZero's first research paper, and we're very encouraged by the process, by what we found we could contribute to the general knowledge on this topic. We absolutely expect much more research coming out in the next couple of months and years. Not only, this was kind of a literature review, but we also want to start doing research on our own efforts and seeing how effective some of the initiatives that we have piloted, ourselves, how effective those are, and hopefully we can learn from that as well. So much more research, many more papers to come. Hopefully this is just the beginning. So we're very excited to share the rest of what we have coming with you soon.
Well, just from the initial reports that you have and the information that you provided, it's all, very exciting about the potential impact on something that, as to your points earlier, it doesn't take a lot of time. It doesn't really cost anything more than the initial training would anyway, but it does have a potential profound impact on end user care and outcomes. So it is pretty exciting, the work that you guys are doing.
Absolutely, yeah. Thank you so much, and thanks again for the opportunity to get this work forward towards people in JEMS, and even as part of this podcast. We really appreciate it.
Well, thank you all for spending some time with me today. It was very nice meeting you, and the information was great. As this is National Stroke Month, of course, in the United States, another very important just awareness to have everybody understand a little bit more about what's going on. And then, to the point of, EMS being stressed as it currently is, proper utilization and maximum utilization of the resources that we have become critical for patient care and outcome. So thank you for your work. This is all very exciting. We look forward to more great things from you guys and MedicZero and your expansion of your program. So thank you.
Yeah, thank you again. And hopefully we'll be back here soon with some more exciting stuff.
Yeah,
We look
thank you for
forward to
sitting.
it.
All right, take care.
Bye.